allocate amount fulani. So utakuta kwamba kuna dawa ambayo tunatarajia iwe kwa dispensary. Kuna dawa ambayo tunatarajia iwe kwa health center. Na same to the level 4 facilities. So when these orders are made, the sub-county pharmacists will look at them, waangalie orders of facility kutoka sub-county yao. So they make corrections at that point. If maybe kama mtu kama order iko juu sana ama iko namna gani, ana rationalize at that point. Then they go to the county, akisha ridhika nayo, sasa order inaenda KEMSA. Sasa unajua KEMSA inapata order kutoka counties
47.
So order yetu itafika pale. They'll start processing that order.
Yeah.
And that will depend now on the kind of workload that they have. But usually that can take a week or two. It depends on the workload that they have, because they have to get the drugs, put drugs for every facility, package them, and then now eventually they are given to the logistics person.
Yeah.
Kuna kampuni ambazo wamekuwa contracted na KEMSA ambao wataleta hiyo dawa mpaka Sabor ama kama ni Mokoro, whatever. They'll deliver. So we have to allow time for those processes to happen.
Yeah.
Ideally, we should be doing this every quarter. Every 3 months, we should be doing these orders. But then sometimes there are challenges which can relate to many things. It can relate to maybe access to funds. It can relate to the budget that we have. So that frequency can vary. But if we actually aspire to do it on a quarterly basis, that way, unajua dawa, hiyo supply ya dawa ni kama tu pipe ya maji. If it is empty, hata wakati utapata hiyo supplies, utakuta tu yarudi to the normal stock instead of being above the normal, because there is a maximum and minimum levels. So kama tangi ni empty kabisa, hata ukiongeza haitajaa. So that is what we really need to work on to ensure that the flow is continuous, so that it doesn't get empty.
So that is a process.
Yes, that is a process. So you asked the question about whether we have some punitive measures.
When there is laxity.
When there is laxity.
Yeah.
Yeah. When you look at it really, when a facility doesn't have supplies, we look at the factors, what could have contributed to that situation.
Yeah.
Yeah. Because of course, if somebody has been negligent, if they've not met their orders, then that will require disciplinary measures. But then if other factors contributed to delays, then really we might be pinning down somebody for something that is beyond their capacity.
Okay.
Yeah, but that information comes to us from the sub-county health service coordinator and the sub-county pharmacist, so they'll help us to see what could be the reason behind it.
So tukiangalia labda from what I'm saying right now,
yes,
majorly it's about the process,
yes,
of obtaining medical supplies from KEMSA. So what would be the long-term solution, really?
Okay, there are many factors. One of them is a process. But remember, the main one is inadequate financing. That is the main one, really. Because if we are requiring, if what we are getting is a third of what we require, then what will happen to the 2/3?
Right.
There'll be a shortage.
I agree with you on that. And that goes again to wananchi. You realize kwamba funding ya medical department or other health department iko chini kwa almost 2/3. Wanapokea kwa sasa wanapokea 176 million and the required budget is 430 million. So hata sasa vile watu wanapiga campaign, sijui mnasikia kama kuna mtu anasema ataongeza budget ya health allocation or rather ataongeza allocation ya health department. Sijui kama mmesikia. Na kama mjasikia, that is something you also need to interrogate, because people are coming to ask you for their vote, for your vote, and this is a period of transition and we are going into electing new leaders or even bringing or rather re-electing those who are already within power. And if they are coming back, do they have plans of increasing that budget? And if we have a new governor coming in, is he or she bringing, do they have an idea that the health department is underfunded? Na kama hawana, nyinyi kama budget champions, unawauliza nini. Na kwa wenye wanafuatilia kwenye mtandao, you've also learned something about the funding within the health department. We are learning about the challenges that the department is facing with regards to funding, and also the majorly, if it is about funding, then what plans do the people who are vying for these influential seats, what plans do they have for the health department? So kama uko na swali unaweza tuweka kwenye comment section. We are live on Facebook and YouTube, Baringo News, and the Center for Enhancing Democracy and Good Governance. Well, with us here are the officers from the Department of Health, and they're helping us to understand the preparedness of the county government, Department of Health Services, in ensuring that we have continuity in service delivery during this period of electioneering. And we've looked at issues to do with the staff, funding, and also infrastructural development under the health sector. And maybe to you, Bwana Mulamba, there are cases of delayed delivery of projects, or rather completion of projects. And one among these budget champions, while we were preparing for this conversation, there's one that popped up. Ketindui dispensary. They're saying it was awarded to a contractor. I think it was in April. Started in July, and the project should close in September. I'm sure there are others of such nature. As the one in charge of infrastructure, you have said much of what we are trying to achieve is work in progress. Umeweka mikakati gani kuensure kwamba kuna speedy delivery of those projects, or rather completion of those projects, so that services ziweze kufikia wananchi kwa muda ambao wanahitaji?
Okay, thank you very much. The concerns are valid. In most cases in the past, we've had delayed implementation of projects, and largely contributed by contractors. Once contractors are taken to site, it is normally their responsibility to make sure that the contract is implemented as signed. And therefore, in most cases, we've had delays, and because of the contractors. Picking the case of Ketindui, for instance, we took a contractor to site, and he had to take almost more than 6 weeks to report back to site to start the construction works. I'm happy he's back on site and is already moving at a pace. However, we have a timeline. That timeline gives us the opportunity to be able to terminate those contracts and re-award them to contractors who can be able to run on time. However, I know the challenge that goes with that, the increased cost which might come as a result of project contract termination. And we also have a challenge of perhaps delay again in new fresh procurement. So I don't expect the Kitchendu to let us again go into issues of termination. We are trying to reach them. What I'm also happy with the county government, the last few weeks we've seen tremendous payments to contractors. Most of them have reported payment and they have resumed back to the site. Trying to reach most of them to make sure that they don't get disruption during the period when we are going for election. That our contracts never took into account that there will be an election. So we expect them to